Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone.
Hey Staten Island, for Pride Month, we're visiting the Alice Austen House Museum in Rosebank, a significant site in LGBTQ history and landmark of social reform photography. Our guests today are Dr. Nicole Berwald, who is Staten Island University Hospital's Associate Medical Director and Chair of its Diversity and Inclusion Initiative, and Bisi Apanpa, Operations Manager of the hospital's Infectious Disease Program. We're learning about Northwell's commitment to healthcare access and equality, and more specifically about the effort SIUH is making to better serve members of the LGBTQ community. Give a listen.
Hi, I'm Nicole Berwald. I'm the Associate Medical Director over at Staten Island University Hospital. I'm coming to you today from the Alice Austen House with one of my colleagues, Bisi Apanpa, to discuss some really important topics, both to us personally and to our organization. Before we get started, I'm going to let Bisi introduce herself.
Thank you. My name is Bisi Apanpa, and I am the Operations Manager of the Infectious Disease Program at Staten Island University Hospital. We provide preventive services to various individuals in the community, ranging from PrEP and PEP services, HIV testing, HIV primary care services, STI testing, and various other forms of sexual health services. And I joined Northwell around May of last year. I've been with the company for almost a year now, and it has been rewarding in terms of the overall initiatives that we've created in terms of being able to present various services to community members. And it's just great to be here with you and to speak more about the overall outlook when it comes to Staten Island University Hospital's initiatives when it comes to members of the LGBTQIA+ community.
Yeah, so I've been at the hospital for 14 years now, and in one of my roles, I head up some of our diversity and inclusion initiatives, and as an arm of that committee that I partner with other team members to run, we look at our LGBT initiatives for the institution, for the community. And I know you said you've only been with us a year. It feels like much longer because I think I must have met you the day you started, and you really just rolled right into those initiatives with us. And I know there's some things that you're doing through the virology clinic and through the service line that you work with to really bring those initiatives further for our physicians, for our patients. And I was hoping you could speak to them a little bit.
Definitely. So the initiative actually started November of last year. It was just a conversation that I was engaged in with the medical director of the CART Institute in Manhasset, Long Island, in regards to if Staten Island University Hospital had an equity officer and what would happen if a patient called requesting to see a provider that was an ally to members of the LGBTQIA+ community. And I couldn't give him an answer because I wasn't sure and I wasn't aware. So that led me to reach out to the diversity and inclusivity team to speak with them. And I was engaged. I said, okay, so we're going to have to create this. We're going to have to create that channel to members of the LGBTQIA+ community to be able to schedule sessions with providers that are seen as allies. You do not have to identify yourself as being a member of the community in order to be able to provide access to care. But being an ally, I think, bring comfort and safety net to the members in order for them to engage in life-sustaining care. And being the operations manager of the Virology Treatment Center, we have a high percentage of our clients that are identified as being members of the community. It's engaging to see that now they're really interested in this initiative as well. Some of them, they do not engage in life-sustaining medical checkup because of history of bias, discrimination, and various other concerns. Now that they know that we are creating this initiative, which would allow them to be able to pinpoint a provider that identify himself or herself or themselves as being an ally, they will feel more comfortable to engage in these appointments and actually follow up. And it does transmit to the overall care that we provide within our department, because it is not just the HIV aspect that they have to be concerned about. Some of the patients, they do have other comorbidities. They have diabetes. They have various other health issues.
They have everything that everyone has.
So it is not just the infectious disease component that we care about. we approach them from an holistic point of view. We want them to also focus on the other ailments that they might be suffering from. So we're trying to create that channel, create the list of the providers. And it's very simple. If you're a provider within Staten Island University Hospital and you have the experience and you welcome, individuals from whichever walk of life to your settings, you say, yes, I am willing to participate, and we're going to put your name on our list and give it out to the different organizations on Staten Island and have these members, schedule the appointment and follow up with the life-sustaining checkups.
Yeah, I think some of what you say is so important because it does transcend even just this group that we look at. I know for myself, when I select a doctor, I want to pick someone I'm comfortable with, who I think will relate to me as a person, so I can be as open and honest about my own healthcare needs. And I imagine most people feel that way and want to get that. And when your sexual identity is such a big part of who you are, you really need to express that to get that full global care for yourself. And the team you're building with this will really speak to that. I shared this story with you before, and this conversation makes me think of it just needing to have that comfort for who you are as a person. And I'll share it again because I think it speaks to this initiative. I know I said some of my roles already, but I'm also an emergency physician. And I'll never forget the day that one of my residents came to present a case to me, and they really came back with little information about the patient. I'm like, well, they're here for something, and they didn't have that information. And I said, let me see what's going on myself. And I went over to see that patient, and it happened to be someone I had encountered on 2 other occasions. Once as a patient, and once when they were a visitor of another patient in the ED, and it was a transgender woman who was there. And the first time I took care of her, she looked like her usual self. She had her hair done, her nails done, all the things that made her feel like who she was. The second time I saw her, when she was a visitor, actually with her partner, again, looked like her usual self, really put herself together in such a beautiful way. And when I went to see her on the time that she came in as a patient, the second time I saw her as a patient, when she really didn't feel well, she was not put together. And I said to her, I was like, we've met before, I don't know if you remember, you just don't look like yourself today. You didn't do your hair and your makeup, you don't look like you. And she said, Doc, I really feel bad, and here's why. And when I went back to speak with my resident, they said, how did you do that? How did you feel comfortable speaking to the patient this way? How did you know that by bridging that gap, you would get that information? And I think it's just this comfort level that we need to expand to all of our providers and to get them to meet the patients where they're at. Because that's our responsibility. You started to say that we're doing this. I think that there's more to the program that you even said, right? Because along the lines of what I just said and more, I know that the program also comes with education.
Yes,
can you speak to that component of it?
Yes, definitely. So all of the providers that are participating in the initiative, even those that are not participating in the initiative, we're now trying to provide them with the opportunity to learn more about the different ailments, just different impacts that the LGBTQIA plus community face on a daily basis. We are partnered up with the Berg Institute. I believe you will speak more about that shortly. And then we also have the annual education, which is required for all members of Staten Island University Hospital to engage in, regarding just being more aware and also being educated on the different aspects of what they face on a daily basis. I think we have the inclusivity courses. We have just various, it's too many for me to even list, but it's just a great opportunity being presented to the providers identified as the competent healthcare provider to members of the LGBTQIA plus community. Once you register and you agree to be part of the initiative, you will be provided with access to the education. And even if you say, no, I don't think I want to be a part of the initiative, that's fine. We're still going to offer you the opportunity to engage in learning more. And I said earlier, you do not have to identify yourself as a member of the LGBTQIA plus community in order to be a part of this initiative. I myself, I may not, identify as being an LGBTQIA plus member, but in a way I am, because I am an ally and I'm advocating for my patients. I have a high rate of individuals that do identify as, so I have to advocate for them. I have to make sure that whatever they need, I'm bringing it to the forefront. And being in this kind of position of leadership, you kind of have the opportunity to sit at a table and present the challenges that they face and see what we can do to meet their needs. So I think with the providers as well, if we can provide them with the resources when it comes to education, when it comes to different initiatives, I think it also just provides a well-rounded service to various individuals. And I think it's just important that we continue to engage in education. Yeah.
And when you speak about allyship, I think it goes to the heart of a lot of our D&I initiatives in the hospital, right? Not everyone identifies as everything, but we're there to support all of our team members in the things that are important to them and how they identify, and for our patients in our community. Yes. And this conversation just speaks to one of the groups that we're doing that for, whether or not you identify or not, but it does bring that you cannot rely on the people who identify as a certain group to do the work for themselves. Yes. They do need the voice that you are helping to amplify through your projects, through the team members that we're engaging with. I mean, we sent out this ask to join us on this journey, and within weeks had over 50 people, then over 60 people who wanted to sign up, and that number keeps growing. And I know it will continue to expand, but it is those allies that have to amplify the voice of the needs of the people that we're responsible to deliver care to. And that is our mission and vision as the organization, to be able to do that. I will speak to one of the education things that you mentioned. We are, as part of Northwell, open to a lot of different educational opportunities and shown the opportunity to participate in different programs. And from one of the ones I think that you were alluding to, we had so many education hours, hundreds of education hours between our two campuses, that we were identified as a 2022 leader in the LGBTQ Healthcare Equity Index leader, based on just this educational opportunity. And I think it's some of these things with the education that really gets to drive the messaging home to all of our healthcare heroes on the front lines, because this education is not just for providers, it's really for all team members. And I know that we have the plans to engage and continue to engage with that group in the educations that we can provide.
Yes. Thank you for bringing that up as well, in terms of, the education being offered to all staff members, not just to the providers. I know with my department, I made it very clear to all of my staff, you have to engage in the education opportunities, especially thinking of the clients that we do serve. So it is important that we are aware and we are educated, and that we are also involved in as many initiatives as possible, and thinking ahead, right? Aside from advocating for members of the LGBTQIA+ community, I think with this initiative, it just brings up the amazing opportunity that exists within Staten Island University Hospital, with providers just willing to join together. Initially, I thought this would be done within 2 months. I came up with the idea. I said, no, within 2 months, we're going to get a list of providers. We'll be able to just, distribute the list to the agencies, and we're done. No. And which is great, only because from this initiative, now we're thinking of other possible initiatives as well. And it's just amazing the amount of individuals now involved in not only focusing on, creating access to care to the members of the LGBTQIA+, but now we're like, okay, what can we do in terms of women and female care? Are we able to now think of creating a list of providers that are focused when it comes to different ailments that women face? Can we create that as well? The same type of initiative where you are a provider and you are experienced with providing care to female needs. Okay, so now join the board and, engage in research, and maybe let's look at Native Americans. If we have them, we have providers. Would you like to join a different, initiative? I think it just opens up the opportunities for the agency, the organization, to be able to engage in various initiatives, providing access to care to all individuals. Doesn't matter your, ethnicity, your background. We're here to provide life-sustaining care to everyone.
Next time, we touch upon Northwell Center for Equity of Care, its CATS Institute for Women's Health, and SIUH's work with the Pride Center of Staten Island. Don't miss it. HealthWish wishes to thank our very special guests: Dr. Nicole Berwald and Bisi Apanpa, as well as our gracious hosts at the historic Alice Austen House Museum in Rosebank. We're interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.